A new study getting a lot of attention on social media is saying that sexually transmitted diseases in Charlotte are among the highest in the nation. Well, the Queen City rating in the top 20, while the Mecklenburg County Health Department is pushing back on these findings, they still say the numbers are not good. Now, Queen City News anchor Derek Dellinger is here with us to give us an explanation on this data. And Derek, I also want to be able to add, this is something that is very sensitive because you're talking about STDs, but this is also something that they really want to highlight, showing the stigma about talking about this conversation.
Yes, and we need to say at the outset, this is something that may make you have a guilty laugh, or it may be something that is quite honestly just a little icky to talk about. But we do have to be serious about this. You may remember a couple of years ago, we did a story on people not locking it down during COVID lockdowns and STD rates going up. Thing is, for the most part, the numbers have not gone back down.
On the outset, the numbers may be a surprise. Then again, they may not. But as the Mecklenburg County Health Department says,
the numbers speak for themselves.
The numbers speak for themselves. Dr. Raynard Washington is the county health director. The numbers he's talking about are the sexually transmitted infection numbers for the county, something which has gotten a bit of attention lately. You may have seen this going around, a study showing Charlotte ranking unlucky number 13 on the list of top cities with high STI rates. The county is quick to push back on those numbers, saying they appear to take into account the entire metro area, which includes Gaston, Cabarrus, and York counties. But Mecklenburg's numbers still are not good.
I would say things are not great, but we are working hard to make progress.
The latest data is from last year, and while the numbers are preliminary, rates of HIV, chlamydia, and syphilis have ticked up. Gonorrhea has ticked down just a bit. It's also disproportionately affecting those in their 20s and who are African American. We ventured out to get some reaction to the numbers. Some noted even now there's a shift towards more traditional dating. We spoke with a married woman who has seen it among her friends.
More intentional, okay, I'm looking for someone, I'm looking for a long-term relationship, and it's a little bit more siloed, not as much, meet someone out.
And a single man who says the numbers may need a deeper look.
Could be for a whole lot of other reasons, for sure, in there. And so, just a trust in healthcare and things like that.
But some have noted the city's dating culture, and others have noted attitudes about either revealing or getting an STI that are still present. Dr. Washington says, if anything, the numbers show the need for conversations, no matter how uncomfortable it may be.
It's not about the ick factor. It's about trying to keep people healthy. There are certainly, particularly with illnesses, some of the ones that are transmittable to babies and things like that. It's really important for us to make sure folks are getting tested and treated as quickly as possible.
One big important note there, not the ick factor. One important note here from health officials on this: birth control pills help someone from getting pregnant. PrEP keeps a person from getting HIV, but neither protect from gonorrhea, chlamydia, or syphilis, which require antibiotics. The advice pretty much has been said for decades. They are advocating for the use of condoms, and a note that STIs, they are becoming more antibiotic resistant. So that means you're either going to need more or a different type of medication.